Hello, everyone. It's Rob, and I'm back with Dr. Hache. Today, we're going to continue our series on eye health. Actually, wrap it up. We're going to be talking about the tooth relationship to your eyes and how your teeth will directly impact how healthy your eyes are. So, as usual, John, you going to take it away?
Thank you. During my various trips I did to the Dallas Fort Worth area, I was privileged to run into Dr. John Bond, who's been a good friend of mine for many years. And John is an orthodontist, and he it is almost scary, if I asked John to speak to the class, and everybody would be covering their mouths, and they go, "Oh my God, I gotta go see my dentist. There's something going on."
Yeah.
And so, but John was one who did an awful lot of research, and he understood the correlation between teeth and health, and the correlation between teeth and eyes, and one of the things that he understood as well is that, and all dentists do, is that there is a correlation between heart disease. 1/3 of all widowmakers are caused by bacteria in your teeth, and that bacteria can migrate from, let's say, from your gut from what we call microbiome now, the microbiome to the mouth, to the heart, and it can be a real mess. So if you're having chronic eye problems, you possibly want to take a look at maybe infection caused by root canals that have been poorly done. I know John Bond, his whole career was cleaning up on badly done root canals.
A lot of work.
A lot of work and a lot of cleaning up. It costs a lot of money for a lot of people who'd already paid for and gone through all of this terrible intervention, only to find that the root canals were badly made and they were actually killing them or killing their eyes and killing parts of the body. So yeah, chronic, persistent problems with your eyes, especially the upper teeth. You want to make sure that everything is clean in
Because those
there,
are all heading up.
because that seems to be where the problem also lies. Now, you probably want to talk about this tooth-organ relationship.
Yeah, so this is something we have talked about quite a bit here. I hope you can see that pretty clearly. This is the tooth organ relationship chart. And you can see how in depth these relationships are. Every tooth is connected to multiple organs. And John, you were saying something about them being the fuses of the human body.
Yeah, in an electrical system, we have a fuse box and or switches today. We don't in my time we used to have fuses that we kind of
Screw in there.
screwed in,
Yeah.
but now they've been replaced by kind of flip switches, so that you can see the instead of blowing the fuse, you just flip the switch over. So these teeth are like fuses in the box. And believe there's the trigeminal nerve, which is part of the cranial nerve system, actually plays a big role in each one of the teeth. So the nerves, the trigeminal, the facial nerves, and the nerves for all of the system, let's say for the eyes and for uh, incidentally, the eyes and the trigeminal nerve also go together.
Yeah,
Incidentally,
yeah.
so the cranial nerves play a huge role in eyesight, and you'll find that each one of these teeth actually connects to organs and systems. And what we've done with this chart, this is one of our own charts. We've got to correct the
Corrected.
charts,
Yeah.
existing charts, because they were actually
They were wrong.
they were wrong.
Yeah.
So we had to come up with our own chart, which is the pain free for life chart. And you'll find that each one of these teeth actually connects to these organs and systems. And you'll also find that fire, earth, metal, wood, water, and that they also connect to what we call a constitution. So depending on your constitution, let's say I'm a metal constitution, lung and large intestine. So I'd look out on the chart and I'd say lung, large intestine. Let's see over here. Oh yes, look at that. So the teeth that I would worry about is number 14, 15, and over here would be number 4 and 5 above. Yeah.
So you can draw on those relationships to sort of see
Yeah.
these health concerns.
Well, this is really interesting. It's just so funny because when I first introduced, when John Bond came to my courses in Dallas, I came, I was talking about the holistic dentistry and how these charts correlated with teeth. And here I am talking about teeth, and the dentist is sitting in my class.
Yeah.
But he was very kind. He didn't tell me that I was full of BS, although that's what he believed. Until about maybe 6 months later, he came back to another course and he said, Dr. Hache mentioned something about this tooth
Relationship.
organ relationship. He says, I thought he was full of crap. He says, but I did my research and he's totally spot on. He said, I just want to say that because he said, I'm sorry I doubted you because this turns out to be totally true.
Yeah.
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 So a lot of dentists, holistic dentists, use these charts. This is a holistic dental chart as well. So the holistic dentists do believe the connections, and Chinese medicine also correlates with this.
Yeah. So it's really fascinating stuff, and it's a way to continue to keep taking microcurrent further and further and further. And the more we do this, the more we realize that it is at the basis of everything to do with our health. It's all these connections we have, and we can work through.
Yeah, well, we are totally electric, the body electric. I remember Robert Becker wrote a book years ago. I don't know if I probably have it back
Somewhere on the shelf, yeah.
somewhere on the shelf, the body electric. And he called it body electric for a good reason. As our body has all of the transistors and the other electronic circuitry that you would find in any fine piece of equipment. We have it pretty well built into our bodies. So our capacity to be able to communicate from cell to cell to cell, 50 trillion to 100 trillion cells that need to be knowing, omni-knowing, constantly, all the time. And so this electrical system works extremely well until a fuse blows.
Fuse blows. And I know, we'll wrap this up in a second here, but I've talked to patients recently as we've been bringing this chart more into the limelight, and we're sort of seeing, oh, hey, look, they'll say, oh, I cracked a tooth.
Yeah.
I'm also having bladder issues. And then you look at the chart, and lo and behold, the damage to the tooth triggered the bladder issues, or perhaps even vice versa. Does it create a weakening of the teeth?
Well, and it's kind of funny because if you look at the chart, you'll see like bladder issues. You find kidney, bladder,
Mm-hmm.
and you'll find that a water type constitution. In the Chinese medicine, water constitution means that they were going through fear and insecurity at that moment. And if you question them further,
Yeah.
you find that that's crazy
Spot
stuff.
on. Yeah.
But that's exactly what happened. I was going through this moment of insecurity.
Yeah, absolutely.
Yeah.
Okay, well, I hope you enjoyed this. I hope you found it informative. Let us know below. Let us know what else you'd like us to talk about. But otherwise, thank you for watching.
We've got lots of subjects.
Lots of stuff.
Oh,
Yeah,
lots
we could just bring them up and go on a roll. So, all right, everyone, have a great day. Bye.
Thank you. Bye bye.